and we start now with the plan for today, our agenda. So yeah, we start with an introduction to the general topic and why this topic is relevant for Naturland and for Naturland social responsibility. And this introduction is given by my colleague Thomas Beutler. Afterwards, we have our first speaker, Dr. Halshka Graczyk from International Labour Organization from the UN, and she's going to talk about implications for safety and health of work, heat at work. Very happy to have her here today. Her talk is followed by Jason Glaser from La Isla Network, and he's going to present La Isla Network, his projects and best practice examples. And yeah, we have another point of view here. This is followed by a guided talk with our experts. So we prepared some questions that we would like to discuss with them before we open the discussion to all of you and are yeah, asking you to also join with your comments and experiences and questions. So this will be the end of our session today. Yeah, and I think without further ado, oh no, one more thing, all slides will be shared. So no worries, you don't need to take notes the whole time. We will share the slides with you afterwards. And there's also Spanish translations for some of the slides, and you can find the link for that in the chat as well. So if you prefer, you can open the Spanish translated slides on your computer. Okay. Without further ado, I think I'll hand over to my colleague Thomas for the introduction to today's topic.
Right, thank you very much. So I can't see you. Can you hear me right now? Yes, all right.
Yes.
Okay, perfect. Yes, a warm welcome also from my side. My name is Thomas Beutler, and I'm responsible for the social department at Naturland together with my colleague Ann-Kristin Schmidt, who gave us a first introduction, and also with my colleague Angela Vasevich. I think she's part of the audience. And I'm really delighted that we have, yeah, already a large and interdisciplinary audience here online today. And I would like, yeah, and I will briefly introduce the topic during the next minutes. And for those of you who are not yet familiar with Naturland, I will also provide a short introduction to our association before moving on to today's topic, and before I will also introduce our speakers. So some notes about Naturland, about our association. The Naturland Organic Farmers Association was founded in 1982 in Bavaria, in Germany, and generally we promote organic production and social recognition of organic agriculture worldwide. And this is our concern because climate change threatens our livelihoods, and we see organic farming as a means of reducing the effects of climate change on the one hand, and on the other hand, of making stakeholders along agricultural supply chains more resilient to the effects of climate change. And around 128,000 farmers in over 60 countries produce food in accordance with our internationally recognized Naturland standards. And outside of Germany, they are mostly incorporated in smallholder cooperatives or producers associations, or outside of Europe. And globally, our producers farm around 750,000 hectares of land according to the Naturland standards. And our work enables us to contribute towards protecting the environment and its resources, ensuring food security and improving people's living condition. And we are organic in our whole thinking. And for us, that also means being socially responsible as part of a holistic approach towards sustainability. And that's why social requirements are a key component of our Naturland organic standards. And in other words, our members must not only meet environmental standards, but also standards of social responsibility. And that is another reason why we want to take a look at the social components of climate change today. But why do we need social responsibility in agriculture, also in organic agriculture? Basically, it can be said that work in agriculture generally, and globally spoken, is often precarious. Workers within the field of agriculture often face problems with low wages, insecure employment conditions, lack of access to social services, and also workers in agriculture often have a migrant background, what makes them fundamentally vulnerable to exploitation. Furthermore, it's often physical, hard work, and therefore working agriculture can be dangerous, talking about working accidents or also long-term physical effects. And therefore, all Naturland certified businesses, from the producer to the processor, must not only comply, as I said, with organics, with our environmental standards, but also meet the social responsibility criteria, which are independently audited on site worldwide on an annual basis. On the slide, you can see our social standards contain of 7 standard points and also 7 sub-standard points to create and sustain decent working conditions. Before I will briefly come back to Naturland for a second, I would like to broaden our perspective a little and also to introduce the topic of the seminar right now. So generally, the impact of climate change on the world of work has not received much attention so far, neither in politics or media or society. And yet, climate change is changing the world of work in a variety of complex ways, from the loss of livelihoods and migration to climate-related forced or voluntary labor mobility to deteriorating working conditions such as occupational safety itself. However, in summary, 3 main effects of climate change on the world of work can be identified. First of all, jobs and services that are ecosystem reliant, essentially food and natural resource production, are highly vulnerable and therefore are a risk of loss. Sectors such as fisheries or subsistence agriculture, along with occupations including forestry workers, small-scale farmers, and traditional fishing communities exemplify the types of jobs and services that depend heavily on ecosystems and as a result face a significant vulnerability to environmental changes and degradation through sudden or slow onset climate events. Secondly, many jobs are vulnerable to the intensification of climate change impacts and thus potentially increasing occupational safety and health hazards and reducing productivity. For example, extreme heat stress diminishes the capacity to work in outdoor environments in a growing number of world regions and exposes workers to dangerous health risks. Just as an example, we will dive into it later with our experts later on. Or vector-borne disease has become an increasing threat to workers as well, as to mention only 2 examples. And thirdly, the impact of climate change hazards on the world of work tends to disproportionately affect those groups of workers who are already vulnerable and lack access to decent work and social protection, such as women, workers within the formal economy, migrant workers, impoverished households, indigenous peoples, persons with disability, or other disadvantaged groups, basically often people working in agriculture. So in summary, the risks and hazards associated with environmental degradation tend to affect vulnerable workers the most due to the risk of job losses or dangerous working conditions. Of course, a single webinar cannot cover the entire nexus of climate change and work, which is why we want to focus specifically on the topic of heat and work today, since it affects us all around the globe, even within the northern countries like Germany or in Europe. But we also want to discuss the topic here today because we want to place greater emphasis on it at the social sector at Naturland in future. So after all, our standard states ensure safe working conditions for all employees. And from 2026, the issue of heat will also be included in the Naturland social checklist as part of an occupational safety and health. And of course, we want to continue to raise awareness and exchange ideas with our international experts. Today, we would like to change experiences with those who are affected and other practitioners. Yeah, that is why we would like to dive into the topic of heat stress today. So now I would like to introduce our speaker. I'm really, really grateful and proud that we were able to invite high-ranking and internationally recognized experts and speakers for our webinar today. And I really need to stress it because both of you were really busy. So thanks for being with us today. Our first speaker today is Halshka Graczyk. You are a technical specialist since almost 10 years at one of the first and oldest specialized UN agencies, the International Labour Organization. And you have a PhD in toxicology, and you're an expert in occupational safety and health and in international policy. You will provide a holistic scientific, political, and practical review of implications of climate change on working conditions and occupational health and safety generally, and specifically regarding heat stress. And we are particularly pleased to have you here from the International Labour Organization, not only because the ILO core labor standards are part of our social standards, but also because we've been increasingly engaged in dialogue with international labor organizations, country offices in various countries around the world for several years right now. So great to have you here. Welcome on our virtual stage. And before I hand over to you, our second speaker is Jason Glaser. You are a researcher, activist, CEO, and founder of the Isla Network. And you and the Isla Network are generating, supporting, and executing evidence-driven solutions to address workers' health in a changing climate. And you and the Isla Network's team are improving working conditions and supporting the creation and enforcement of policies required to protect workers and supply chains worldwide. So I think you have a lot of practical experience at the grassroots level as well, and you will bring them on the table later on. So also welcome, Jason. All right, and now I will stop sharing my screen and hand over to you, Halshka.
Okay, thank you very much, Thomas. It's a pleasure to be here with all of you. First of all, I really would like to thank Naturland for the invitation to speak. It's a pleasure to be sharing our results with you and with the wider community on a topic that is so critical for almost 1 billion workers around the world, those that are engaged in agriculture. A quick note about the ILO before I begin. The ILO is, as you mentioned, Thomas, the oldest, in fact, specialized agencies of the United Nations. We're unique because we bring together a tripartite group of constituents. So we bring together governments, usually through the ministries of labor. We bring together 187 of those governments as part of our executive body. But we also very critically work with workers' unions and workers' organizations, as well as with employers and business organizations. Like this, we have a tripartite approach to the work that we do. And this is critical when we're setting our labor standards, when we're setting the global foundation for what decent work should look like. So before we jump in to the topic of heat stress, I think it's critical that we understand that when we're talking about hazardous exposures to workers, and particularly agricultural workers, we're not only talking about heat. Heat is part of the puzzle, it's part of the climate challenge, and it's very critical. However, all outdoor workers that are part of agricultural supply chains, also they could be indoor workers as well, can be exposed to many different types of hazards. We call this often a cocktail of hazards. We are not just talking about heat, we're also talking about intense solar UV radiation, the potential to be exposed to extreme weather events, whether those are floods or droughts or very intense situations where weather can cause harm to workers. We're talking about high levels of air pollution from different manufacturing processes, the rise of vector-borne diseases to new temperate zones, as well as, very importantly for agricultural workers, the potential exposures to different types of agrochemicals. Now, this is critical because workers do not work in a bubble. And sometimes when we talk about heat stress, we tend to leave out the other risks that workers might face. Okay. And beyond just these climate hazards, we have to remember all of the other types of hazards that workers are also exposed to: psychosocial risks, long working hours, ergonomic risks. All of these things come together to influence workers' health. However, today we will look at heat specifically. Heat is something that is touching all regions of the world. It has pushed this to the highest agenda of the United Nations. Last year, the Secretary General of the UN released the ILO report on heat, mentioning that it is workers that are at some of the highest risks of all global populations, noting that over 70% of the global working population is exposed to extreme heat. And this is something that must be at the top of global agendas. So thinking about heat at work and what this means for a worker, I'll echo what Thomas said at the beginning, that this is a limited webinar. I have between 10 and 15 minutes to discuss this topic. It's a huge topic. We could talk about it all day. So I'll give you a snapshot of what heat at work means and how we can think about it for agricultural workers. But what's important to take away from this slide is that the general population can be exposed to excessive heat. Every one of us could be. However, workers, and especially agricultural workers, face additional risks. They're working with heavy thermal insulation, with the personal protective equipment. They are undertaking high physical activity that is increasing their metabolic heat. And as was mentioned before, they have limited rights when it comes to, often could have limited rights when it comes to the rights to know about the hazards, the right to remove themselves, and other kinds of social vulnerabilities. And when it comes to the impacts of heat for workers, often we pay attention to the immediate effects, the acute effects, things like heat stroke, heat exhaustion, collapsing from heat. These are immediate impacts that can happen that are life-threatening and can lead to death. However, it's important to consider that there are many other types of risks as well. So we're talking not only about the acute impacts, but also about the longer term impacts. And I'm sure that Jason, when he follows, he'll talk more about chronic kidney injury and chronic kidney diseases and some of the more longer term impacts of daily exposures to heat. But it's important to consider this impact as not only being looked at heat stroke and an immediate effect. We also must consider the mental health impacts, the psychological disturbances that can happen from lack of sleep, from changes in work schedules to work during cooler parts of the day and not being able to recover because of changes in circadian rhythms. We can see increased anxiety, and as well as reduced focus and concentration in the job. This can lead to things like accidents and injuries, and we've seen from our statistics that they can lead to very high levels of injuries on the job because of heat stress. When it comes to some of our global statistics, our report published the first ever global view of what's happening to workers around the world. And what we found is that more than 70% of the global working population could be exposed. This is about 2.4 billion workers around the world. And we know that this can result in at least 22.8 million injuries. I say at least because this is highly underestimated. This is what we know from the best statistics available at hand. However, we do know that a large portion of the workforce is in the informal economy. There are many problems in different countries with data reporting. And so this is perhaps the tip of the iceberg. This is the starting point. This is already an alarm bell, but it's not the full picture of what's happening globally. When we look at the blue part of the slide, here we see that our results showed that all regions of the world are somehow impacted by heat stress. No region is spared. So we see, for example, in green, the regions with the highest workforce exposed to excessive heat. This is logical. These are regions where they have traditional high exposures to high heat temperatures. So we have the African region, the Arab states, Asia, and the Pacific. And we see also that regions with the highest proportion of occupational injuries attributable to excessive heat are also countries that traditionally have high temperatures, the African regions and the Americas. However, what's interesting to see here is that we have regions with the fastest increasing worker exposure and the fastest increasing injuries. And these are areas in Europe and in Central Asia where we also have traditionally temperate zones, but we see them having a quickly increasing rate of exposure and also injury. So this says a lot about the policy response that we need to implement. Every region will have a different priority when it comes to the policy responses, and this is where it's critical to target what is the particular problem in that region. So here I'll just share a few more statistics. We know that not only the health impacts are critical, we know that productivity losses and the billions that could be saved globally if OSH measures to prevent injuries were implemented. Very important for our financial communities and important also for governments to consider. Now here, I'll draw your attention to the stats that are in yellow, which was a very interesting finding of our report, quite surprising and also important for policy. We found that a majority of worker exposures to excessive heat and the majority of injuries were happening during warm temperatures, but outside of the time of an official heat wave. This is really critical because many countries are now instituting their definitions of what is a heat wave. At what temperature and for how many days does the government, either the federal government or a local government, decide now we entered a moment of a heat wave? And this is often where we have response measures. This is when you often have the release of some kind of heat wave action plan or a heat health action plan. However, what we found is at this point, it's too late. Workers are already being injured and already facing health impacts before an official heat wave is announced. And this is what's so critical for policymakers, employers, managers, companies to understand, is that it's not only the heat wave, it is also just excessive heat that is impacting workers. And this is for many different reasons that we can discuss further. So here, just to give you some more numbers to show you the extent of this problem globally when it comes to the number of workers that are impacted. So here, not only do we show the impacts from excessive heat, but also from solar UV radiation, air pollution, agrochemicals, and vector-borne diseases. We see that this is a major problem for many workers in the world. And this is especially important to consider, knowing that we have almost 1 billion agricultural workers globally, almost 1/4 of the global working population, knowing that they can all be exposed to these hazards. So I probably painted quite a grim picture of what's happening in the world, but that doesn't mean that we don't have ways to respond. The ILO has been working with these hazards for decades. While heat waves and intensifying heat globally is a new trend that is being led by climatic changes, heat has been an occupational hazard for decades. And our first standards on controlling temperature at the workplace have been developed many, many years ago. So we have a foundation from which to work. And we can work at the international level, the national level, and then at the workplace level. But what's important for the ILO is that any interventions follow the spirit of social dialogue. Social dialogue means the work that is done between the tripartite constituents that I mentioned early on. So ensuring that governments, workers, and employers are communicating when they're developing their response. The first thing for response I'd like to highlight is the declaration in 2022 by the ILO's Labor Conference, which is all of our constituents, our executive body, which declared that a safe and healthy working environment is officially a fundamental principle and right at work. It designated 2 ILO conventions as fundamental, and this led to an important paradigm shift in the world in terms of moving to a more human rights-based approach. Because from that moment, it was understood that all of the 187 member states of the ILO have an obligation to promote and realize this right to a safe and healthy working environment, whether or not they have ratified the conventions. So this goes hand in hand with what was described in the introduction by Thomas about ensuring that we have safe and healthy working conditions as part of a social contract, as part of a social responsibility in the workplace. So now sharing a few policy examples and legislative examples on how to address heat stress. That was done in our report. What we did is we looked at how countries are addressing heat stress in the world of work, and we found a few commonalities, a few building blocks, components that are crucial to be part of the national legislation, so to be inscribed officially as part of the legal framework. But then, of course, many of these components then trickling down to the workplace level. So some of the things we see here are the importance of having a risk assessment in the working environment that takes into consideration heat. This is very much then linked to the second one about the identification of vulnerable populations that were also mentioned in the introduction. So making sure that governments as well as workplaces are taking into account those workers at highest risk, whether those are outdoor workers, workers in the informal economy, female workers, older workers, or workers with disability. There's a few other technical components of legislation that we found, one being the use of a temperature measurement as a maximum working limit. I'll describe this in my next slide. But then more issues at the workplace level. So these are things like making sure there are hydration strategies in place, making sure that there are rest breaks in cool, shaded, and ventilated areas, making sure that workers do not start working on the job before they have appropriate heat acclimatization schedules and different measures. Making sure that whatever kind of personal protective equipment is necessary for the job, making sure that it's appropriate for the heat, making sure that workers are using the type of equipment that will keep them safe and not further put them at risk of heat stress. And the very important component of education, training, and awareness on heat stress. We call this the workers' rights to know. Workers have the right to know about heat stress, about their potential vulnerabilities, and about how to protect themselves. Some of our research has shown that the heat cascade, the heat impact cascade that happens in the body is extremely quick. And therefore, workers very rarely can understand that they are at a very high risk of getting to very dangerous zones towards heat stroke, for example. And so this is where training and awareness of heat stress is absolutely critical. And finally, the importance of having regular medical checkups and health monitoring on the job to ensure that workers are fit for work and making sure that workers do not have any kind of vulnerabilities that put them at increased risk for that specific job. Here I included this slide with many numbers in small print to give you an example of why this policy analysis is actually quite complex and challenging for many countries and many policymakers. Here I'm showing you an example of different countries' use of a heat stress indicator and of the specific safety threshold. So in the last slide, I mentioned that many countries are implementing maximum temperature limits. This means that when the temperature, let's say, reaches a certain threshold, so if we get to 30 degrees Celsius or 33 degrees Celsius, in some places in the world, work has to stop for that time. Work needs to be changed to be moved to nighttime hours or cooler hours, or once we reach this temperature, some measures need to be implemented. Things like mandatory rest breaks, mandatory hydration strategies. But you see the diversity of how countries are approaching this. So countries use different heat stress indicators. Some countries just use air temperature. Some countries use wet bulb temperature. Some use wet bulb globe temperature. Some use indoor only, outdoor only. There's a wide variety, and there are different methodologies for arriving at this temperature. So this marks a significant challenge, not only for policymakers, but then employers and managers at the work site to try to follow these legislative measures and also try to understand how to protect workers once they reach these temperatures. So something to keep working on. At the workplace level, we've been working with our field projects to understand what are the evidence-based strategies that help protect workers. Every sector will have different priorities and different needs, but we know that there are basic framework for protecting workers at the enterprise level. And I know Jason will take that further and get into more detail. So where do we go from here? I've given a snapshot of where we stand, what are the big challenges. We're working within a UN approach to try to address extreme heat and promoting occupational safety and health for all workers in different sectors. We're now working on different strategies on how to be more targeted for specific supply chains and specific sectors, including the agricultural sector. So we'd be very interested to hear from some of your members and also hear about the priorities from different regions. I want to highlight too that ILO constituents, our global member states, our workers' unions, our employers have highlighted that changing weather patterns and extreme weather events, including heat, extreme heat, is a critical policy area that demands more comprehensive but also coordinated approaches globally. What I just shared about countries taking their own approach to regulating this problem is something that has moved the ILO to organize the first ever global tripartite meeting of experts on safety and health and climate-related hazards. So we're looking forward to hosting this global meeting that brings together governments, workers, and employers to discuss strategies that unite the world when it comes to understanding what are the foundations for protecting workers. This doesn't mean having one approach for all workplaces in all sectors in all regions. This means having a common framework that can then be adapted to different needs. So we'll be moving forward on that. And this is where interacting with different constituent groups and different types of organizations like Naturland is very critical for the work that we do. I think I've given you a lot of information. I'm happy to answer any questions to get into the more detailed discussion on maybe questions that your members have. So I think I'll leave it here. I'll hand it over now back, I believe, to Thomas or directly to Jason. Thank you so much.
Thank you so much, Halshka. I'll take over for a minute.
Great.
Thank you so much for these insights and the global perspective and presenting the results of ILO's work for decades, as you said. I think we will collect the questions in the chat and answer them at the end. Thank you already. I saw there's already something coming in. I think we'll proceed now with Jason directly and then discuss open questions. Jason, the stage is yours.
It's always a pleasure to follow Halshka and the ILO. They've been incredible allies, and I hope we've returned the favor. They featured our work in the report, and my colleague, who's a Isla Network partner, Andreas Flores, deserves a lot of credit, along with Halshka and Manal Aziz at the ILO, for really, I think, championing the need for the report, updating information that was really out of date, and really provided, I think, one of the best comprehensive reports I've seen out of any UN body. And I don't say that lightly. It was a huge undertaking. There's a lot of clarity in that report. There's a lot of relevant information. It's not overly technocratic. It's a really great piece. So I want to acknowledge that. And it's a really important relationship we have as we work on the ground with companies and workers. And they have both already helped facilitate that. And they are very open to taking our findings and our information to be reintegrated into the dissemination and the engagement that they undertake. So I just want to say thank you, Halshka, as always, and thanks for setting me up. So I'm not going to go over so much the big picture. I'm going to dive in to what we've done, and I kind of would like to start with the idea of, we hear a lot right now in CSR, corporate social responsibility, and supply chain management, the idea of resilient crops in the face of climate change, right? We hear a lot about regenerative agriculture. I'm going to make the argument that we need resilient workforce if we're going to have resilient crops. And it should not be an either or, and it should not be a fashion or a CSR soup du jour, which seems to happen, or an item of the day that seems to happen quite a lot in these things. And I think Naturland understands that, and I think that's a big reason why we're here, is to kind of enforce these as kind of need to haves for the long term, not just a flashpoint. Just a little bit about La Isla Network. We take our name from a community in Nicaragua. It's a sugarcane worker community that has had so many widows from a disease associated with occupational heat stress, kidney disease. And there's so many widows, it was known as La Isla de Viudas. So that's where we take our name. And we started out as a little community organization, and have become, one of the preeminent leaders in occupational health and safety in several supply chains, but also in construction and mining, aside from just agriculture. Our network basically functions as a small core secretariat of experts. I'm an epidemiologist. We have 2 other epidemiologists on staff. We have physiologists, organizational management and psychology, project management, labor econ, and hygienist, and a whole suite of experts that then build a network in different regions with similar experts to actually bring data-driven programs on the ground. So we've worked in India, the Philippines, and you'll hear about some of that, Mesoamerica. We have offices in the US, in DC, in the EU, in Granada, Spain, and then Costa Rica and San Jose. Just want to pass along, I know this is an ag group, but that we have definitely adapted what we learned in agriculture to construction, to mining, to the garment factor. And we are also working with insurers so they can provide, frankly, better and more accurate products to their clients. So this is where I learned about heat stress. It's a pretty extreme environment. And I think to keep in mind for everybody here, I'm guessing your environments aren't as extreme. They might be as hot, but as Halshka noted, the workload and the work intensity are really important when it comes to heat stress. So this is where we learn. There was no personal protection equipment, no water provided, nothing when we started. And they would burn the fields, and these guys would enter immediately afterwards. The environmental heat, the heat from the ground. And many of them work for a full 12 months because they go work in irrigation or green seed cutting during the summer. So they really have, when you think epidemiologically of all the exposures they're having, its duration for the whole year, intensity from the workload, and they are getting this repetitively, and the frequency is daily. There's really no relief. So I think, Halshka, you covered this really well, but I wanted to make sure we understand it's certainly not just sugarcane. It's that heat stress. When we think about it, I used to get asked when I started this work, oh, but Jason, it's hot everywhere. What's the problem in sugarcane? And these are from people that were pretty clever, but we're kind of missing the point that it's that environmental temperature combined with that workload. And then obviously what you're wearing, does it trap the heat? Does it help dissipate the heat? So that clothing and personal protection equipment can both be a help and a hindrance depending on the situation. Solar radiation is extremely important because it will bounce off the ground. And for reasons we don't frankly fully understand, you could be in the same wet bulb globe temperature, which is, a way to look at humidity, mercury temperature, wind speed, and solar radiation in a combination that gives you a readout of a Celsius or a Fahrenheit temperature reading that takes all that into account. You can be in the same WGT, but if it's in the sun, it'll have a tougher physiological effect. The big increased risk that we've seen in our work is majorly reduced productivity. It's about 2 to 3% per degree over 24 wet bulb globe temperature. And I think we have some of the only publications on the actual impact on productivity that's not modeled. Early mortality due to outright heat stroke, exertional heat stroke in particular, is very aggressive and leads to organ failure, tends to localize in the kidney. And then we see acute kidney injury, which is the AKI, and then chronic kidney disease that is subsequent from that injury, but also the daily strain and exposure seems to localize in the kidney. And I think the last bit that's really important is accidents are really related to heat stress, and they're really underreported. That's both how they're coded in emergency rooms, but also on a site. Somebody falls from a ladder because they've passed out from the heat, and it will be tagged as a fall. Or somebody cuts their hand and has a tool injury, and heat stress won't be considered even if it was 42 degrees that day. And somebody cut their hand with a machete or hurt themselves with a saw or a power tool. And we see that, we've been able to show that when we do regression models, meaning looking back in time at the heat and the temperature. And we do see the lag effect that Halshka talked about. There's definitely a lag effect. Subsequent days working the heat lead to poor outcomes. And you have a higher rate of injury overall. So, these are extreme outcomes: heat stroke, acute kidney injury, kidney disease. But in all cases, accidents do go up, productivity goes down. So you kind of think of your main drivers, if you want a simple way to think about it. Think of high environmental heat, insufficient labor protections, and heavy work. And then, the knock-on effects where it's really severe. And I imagine most of the farmers on the call today aren't experiencing anything quite like this, but if you're from Mesoamerica or parts of Brazil, it's been well documented now that you are seeing this kidney disease in these kind of communities, and the knock-on effects are really important to take into account, right? This young guy on that bed dying of kidney disease, he's departed now. He's only 35, and that's the state of affairs for him. And they don't just die of the kidney disease or the heat stroke, but also the infections from the inadequate home dialysis treatment that you see. And what we found in the communities that we work in is that really drives child labor, which is obviously something Naturland and others want to really avoid, right? So there's a knock-on effect of not just the injury, illness, and death can be associated with this, but what does it mean for a family or a community, or indeed a health system that's trying to provide very expensive treatment in the form of dialysis to a population facing a preventable exposure. So what have we done about it? I think that's what everybody would like to know. So we started the Adelante initiative, which means, for the English speakers or those who are more comfortable in English to move forward, to go onward in Spanish. And that was done at a Nicaraguan sugar mill that had really a tough time with sugar cane workers dying of kidney disease, dying outright from heat stroke. And it kind of became a bellwether case to address this issue. And so, thank you for the ILO for pointing out our work. And I think what's interesting about our case study is we actually show hard outcomes on reduction in harm, impact on productivity, and a return on investment. And we have publications coming out on that very shortly. So what do the Adelante do? I mean, basically, we try to manage people's heat stress and their core body temperatures and their hydration. We improve prevention practices in the fields. Big part of this is often overlooked when you're trying to drive change at a company or a farm or in a supply chain. Honestly, like the brands and the retailers also need cultural attenuation, I think, and improvement on prioritizing these things, staying focused on it, and making it business as usual, not just a new program. I mean, that really needs to be the goal, is to shift the organizational culture so that these worker protections are just how business is done. And I think that's a really key thing to take away. So if we had to boil down, because I only have a few minutes, really, like what we're trying to do, hydration is very important. But the fact is you can be fully hydrated and get sick with a heat stroke and acute kidney injury and suffer the impacts of heat stress. So yes, hydrate, absolutely. But I would argue the most important thing we want to manage is that core body temperature. Here's the problem, and Halshka touched on that. Most of the guidance, all of the guidance currently on hand is mostly based on ACGIH rest guidelines, based on a cross-section of workload and the wet bulb globe temperature. Then you have like work stoppages in the middle of the day in like many Middle Eastern countries, also in Italy. And the problem with every single one of these are they're either over and or underprotective. And if you look at this one, which is supposedly the lead, this is what we had to work with when we started. And what we saw was basically on very hot days, nobody would be able to work at all. And this is a tropic, so that's not viable. It also wouldn't be viable in Rome in the summer. And actually you saw articles on this that captured this really well in The Guardian and the New York Times this summer in Rome, where, you know, before the heat stress guidance kicked in, somebody died of a heat stroke working in concrete because it was 2 days before their seasonal work stoppage kicked in. And then when it did kick in Rome, delivery drivers that had comparatively light workloads because it wasn't physiologically relevant could not deliver during the lunch hour. So that's what I mean by overprotective, meaning people can't work when they would be safe to work, and underprotective, meaning it's not sufficient when they're in trouble. And part of that is we heat up really fast, especially if you're working in a heavy work environment. And this is when we were seeing people referred to the clinic. So in our setting, we had the occupational health and safety data. There's a clinic on site at the mill that was a private and public hospital. So we had access to the data, and then we had follow-up data. And to my knowledge, that's the only place in the world where there's that data to see like what happened in the field, what happened in the community, what happened in the clinic, and what happened afterwards. And you can see this, when that temperature goes up early in the morning, we have a very hard time getting it back down to a safe rate. And what happens is that people end up in the hospital quite early in the day before the protections kick in. So what we had to do is basically over time, and this is what all of you will not have to do if we can work with Naturland and their supply chains and the retailers to supply to, we have enough data over 10 years that if we understand the workload and type of labor on your farm and the WBGT range, we can give you a really good starting point of how many rests you need per hour per type of job, depending on the weather, and make a pretty simple table. Yes, I think we should validate that, but it is a much better start than anything you could find off the shelf right now. These things are based on environmental chamber data from the US Army or from universities back in the 60s. They are woefully out of date, and they are neither physiologically relevant at the end of the day or operationally viable. So what we had to do is take long-term health data, accident data, productivity data, operational data, and had to reiterate year after year after year until we got it right. So you can see the cane cutters with very heavy labor, and the seed cutters also with very heavy labor, other jobs with lower workloads. And we had to introduce these breaks till we were maintaining that core temperature in the short term, but also over time, we could see we were minimizing the hospitalizations, minimizing the injury rate, and minimizing, in this case, with this very extreme environment, declining kidney function. So acclimatization's been touched on. I think Halshka explained that really well. It's often overlooked. And I think while it's important in the tropics, generally, you know, it's a seasonal thing. So when people start first going back to work, those first couple of weeks are extremely important. And if people leave for any reason, their first few days back. I think what's happening, though, in temperate regions, like you might think like Germany or even Spain, and there's a heat wave, people have not been acclimatized, and there's an early season or late season heat wave. And indeed, what we saw in France a couple of years ago in viticulture, in the wine and champagne industry, is we saw 6 workers die of heat stroke in September because they weren't acclimatized, there was a late season heat wave, and there was no resilience in the system. So this will take a little bit more work, but it's utterly doable. And I want to show you the kind of detail that we can create. So, you know, our bodies create greater blood expansion. We decrease our heart rate and a response to heat. We increase our sweat rate to cool. That takes time. Your body's changing over time, and it takes anywhere from 8 to 10 days minimum to become acclimatized, and you can lose it in 4 days. So we lose it really quick. So when you think of like our summers where it gets really hot and there might be a break, and it gets really hot in the northern climes and there might be a break, this acclimatization concern is really important. And in fact, public data shows this is when people get into trouble. Those first days at work, those first days of a heat wave. So what we did here is we came up with a very specific acclimatization schedule, and it is by job and it is at production targets. And so we were able to make things, again, physiologically relevant, safety first, health first, but also operationally relevant. And now this would take more time at any one site, but if you group sites and types of work together, I think we could build something. And I think it's something we should think about, because this specificity, I frankly think, is needed. This is really important and not to be overlooked. So how do we do that? I mean, very quickly, we go in with our physiological team and our org psych and hygiene team, and we assess the environmental conditions. We look at, historical data, weather data. We strap people up with heart rates. We use a US Army model to estimate core body temperature. And we basically also look at the organizational culture, and we figure out where our breaks might be between, let's say, there's a harvest guy who's quite old school and thinks this is all a lot of nice to have instead of need to have, who's having a hard time with an occupational health department, or at a smaller farm, none of this exists. And how do we build the capacity for, a family farm that hires workers for a temporary period or does the work themselves? So we really try to figure out like what the reality is on the ground. There's not one size fit all. Then we address in a horizontal way with the workforce, ideally, the supervisors in the fields, the owners, and our research team who's got the experience. And then we assist in that implementation by creating guidebooks, implementation tools, and depending on the sophistication of the outfit, we build technological solutions as well, but we try to make things as low tech as possible so they're scalable. The fundamentals to this are so simple, but it's the devil's in the details, right? And then deploying this in a 100,000 hectare sugarcane farm is another story, right? So the thing is, the breaks are mandated. They're not voluntary. They're part of the day. People aren't docked for pay for taking them. This is a problem we see in the US a lot. There's been articles on this lately. People lose pay because they're taking a break. The break is part of the job. It also helps people be more productive, and we'll talk about that shortly. In these big settings, portable shade tents are really, really important. Back in the day, you see that old bus back there where they transport the workers. They would just put a tent on the side of that, and they still keep that there for some of the supervisors and to keep coolers and whatnot for resupply. But basically that bus acts as a giant oven and traps the heat under that tent. And it's also about 1 kilometer away when the work team's spread out over the fields. So mobile tents are really important. We have designs for how those are made and the materials, and they last about 5 years and they don't cost much to build. They're really useful. They can hold about 15 people. And in this case, we put in a clean water system, RO, UV, et cetera, to make sure the water is clean in case there's any contaminants, which I think Halshka would appreciate as a toxicologist. And then we also provide electrolyte beverages. And then importance of good hygiene and sanitation, especially when you have a mixed workforce. If you're asking women in particular, working with men, you need to drink more water. Well, guess what they don't do when there's no place that's safe to use the restroom? They don't drink water. And then it's not really helpful. The thing is, I think it's really key to evaluate the efficacy of your programs using health metrics and productivity metrics. Otherwise, you really run into the danger of a nice to have. I don't think you necessarily anymore, because of the data sets that we have, ever need to draw blood and urine again to figure out kidney function or hydration. I think there's other ways to estimate that on whether or not you are controlling that core temperature and making sure things are being implemented. But if we do compare places where there was no intervention, the yellow, that's in El Salvador from a couple of years ago, 2 years ago in Guatemala at a mill group that said they had an intervention that was really good and even had a university pushing that intervention. It was woefully insufficient, still quite high kidney injury. And then what we were able to develop. Now, the good news is both the red and the yellow mills are moving closer to the green. So, I think the point is there, even if you're in the red or you're in the yellow, it's fine. You are where you are. You've taken the step, and we want to move you towards that green period. And IKI is what's called incident kidney injury. And the best way to think about that is damage to your kidney over time, in this case, a harvest. The big one, though, is we really want to get rid of that heat stroke, right? Because if you have a heat stroke, you'll have what's called an acute kidney injury. And if you have an acute kidney injury, about 10% of the guys that would have that in this workforce would end up with full-blown disease in a few months. And acute kidney injury is also how your kidneys can shut down and can be one of the reasons you die from a heat stroke, is that kidney failure. So this is really shocking. When we got the data and we made friends with this mill, we got all their hospital data, we got all their event data. And even at a place that tried to have an intervention, they were having 10% of their guys in the heavy workload end up in the ER, in the emergency room, urgent care, every harvest. And that's kind of horrifying when you think there's 6,000 workers, and that meant there were like 500 to 700 workers showing up in urgent care. And because we introduced these interventions, supported with the assistance, we were able to lower that. Now, here's the interesting one, right? All those breaks, Jason, what about my productivity? I have stuff to sell. The guys are paid by piece. Piece rate's a whole other ball of wax. We could have an entire webinar on that. I'm not going to try to disrupt the entire economic model of the agricultural sector, but it does merit some consideration. And I'm happy to say we've moderated it a bit, at least in this setting. But these are the tons people cut per day. And the red was when there was no workplace improvements at the mill. The yellow is when they tried their own. And then you can see in the end when we introduce the Adelante methods. Those are the active work hours a day. This is productivity per hour. So productivity actually goes up. Why? Physiologically, you get to take a break. You can mentally regroup, because one of the things heat stroke does, or heat stress does, is really impact your acuity, your mental acuity, your ability to think clearly. And for sugarcane, it was really effective because the guys would sharpen their machetes. There'd be informal tips between younger guys and older guys. People call this kind of work unskilled. Halshka, I don't know about you, but that drives me insane. These jobs are highly skilled. I think as many of the farmers know, anybody who's worked in those fields, you don't want to just hire somebody to pick your strawberries, your berries, and certainly not cut your sugar cane, because they're going to cut themselves. There's a lot of important mental focus, mental resilience, and tips, frankly. And that stuff kind of happens informally when you take those breaks, and people are hydrating and cooling and able to adapt. So it's good news. Productivity actually went up 9 to 10 to 20%, depending on the group. Did not go down in any of the groups. And the really interesting thing was for the mill. They got a return on investment. Now, if I'm honest, when I started this work, and I've talked to Thomas about that, I think you do these things because people's lives are on the lines, period. I was hoping we broke even on the ROI for the investment in the program and the management of the program, or maybe a slight loss, and you would justify it by the lives saved and the benefit to society. What we found was a 60% return on investment after 3 years. So there's a baseline year, the investment year, 1, 2, 3. These guys are very much in the black. They become more profitable because of the steps they took. And I think it's about, it turns out turnover, they think is about, labor economists say it's about 25% of labor costs. So that's huge right there. And it's because people are less effective at the job, the training, repurchasing, PPE, personal protective equipment, and the rest of it. That's a huge part. Reduce absenteeism. And then in Nicaragua, to their credit, this is an occupational disease, the kidney failure. So you're also mitigating payments in the Social Security system in this setting. And I think in other settings, ROI might be more modest, but so far it looks to be about 22% without that Social Security need. So this just kind of a quick summary of why the ROI. And then you can see that's actually how we measure the core body temperature now without having to use more invasive procedures. Just a heart rate strap, and then we have an algorithm that works, and it's very effective in this community and this population because they're otherwise in pretty good shape, like the soldiers the system is based on. I wanted to touch on organizational management. It's really important at a corporate farm, at a corporation, to have everybody from the C-suite all the way down to the supervisors. Historically, one of our big problems were area managers and heads of area. HR didn't like the program because they thought it would hit productivity. Same thing with harvest department and OSH department, occupational safety and health was below. One of the big things is we brought them on at the same level, and we started managing on health outcomes. So they're measured on health outcomes. We built accountability. We had it communicated to the workforce that this wasn't an either or. If you protect people, your productivity actually goes up. And then we co-designed the practices as much as possible among all the departments. So nobody felt sidelined, nobody felt like they were getting surprised they didn't like. And these things are really important. Org psych, org management really can't be overlooked. And of course, the sophistication of it is going to be different depending on the operational realities on the farm. I mean, really, we've tended to work in larger farms. We've also applied this to smaller farms and smaller cooperatives. And obviously the level of sophistication goes down as the need goes down. You know, if it's a smaller farm with fewer workers, it doesn't need to be quite so sophisticated. Of the fact that we ended subcontracting, contracting practices are part of accountability. Workers have paid sick leave because once you're sick, if you have a fever, that's going to lead to more increased heat stroke risk. We augmented the pay, so there's a baseline payment system on top of the piece rate. And then we have routine data capture and implementation monitoring that looks at health outcomes and productivity outcomes. And we networked the mill's HR, clinic, and OSH departments so they can identify risks early. Hey, it's hot everywhere. It's hard work everywhere. But Javier keeps having people show up in the ER. You don't have a heat problem. You have a Javier problem. So let's go deal with Javier, the supervisor. So that's quite cool. You can see the upstream driver. We introduced a system on how to interrupt exertional heat stroke because it actually has different symptoms than traditional heat stroke. And this has been published, and this is actually now used in the US Air Force for what it's worth. It's interesting that they adopted it though. And I think my vision would be, can we replicate this in other geographies and other industries? We're very strong in sugarcane. We've worked in coconut and agriculture in Spain. But we have a lot to learn, and we're only going to learn that by working with people like Naturland and other farmers, because this is not going to be a one-size-fits-all. Thanks so much. Sorry if I went over time.
Thank you so much, Jason. That was really interesting. And yeah, I think, yeah, we've seen that we could have talked about this for days because there's so much to learn. I particularly find it inspiring and encouraging that those small measures like breaks, shade, sanitation, and hydration can have such a big impact on both health and productivity.